American Mascari with student number 217692617.
Yahya Sinjab with a student number of 215210917.
Parthen Shalan, student number 214927735.
Kamsi Idimogu, student number 216880288.
Kyle Apuz, student number 217088501.
Hi everyone, I'm American, and today Yahya, Parthin, Kemsi, Call, and I are going to present from tutorial N. Our topic is the use of nanotechnology to ensure well-being and good health for all. So UN developed 17 goals to target poverty, reducing inequality, improving education and health, and tackling climate change, and etc. Good health and well-being is the third UN Sustainable Development Goal. The target of this goal is bringing healthy life and well-being for everyone, despite where they live and how old they are. Using nanotechnology, there is higher chances to find treatments for some disease like cancer and diabetes that they have less chance of treatment. And the result would be the reduction in the number of deaths caused by this disease and helping with achieving the UN Sustainable Goal. Countries are making some great progresses because of the UN Sustainable Goal and making changes in their systems, but some of them are far behind in number of healthcare centers and healthcare workers that they need to be sustainable and achieve the goal by 2030.
The COVID-19 pandemic has also hindered the progress of the goal. The rapid spike in the number of deaths and illnesses caused by the virus has overwhelmed a lot of healthcare facilities. The virus has also caused fear in some people, which made them unable to go seek healthcare services like vaccinations, medical checkups, and urgent medical care. An estimated range of 2.5 to 3.7 billion people were covered by essential health services in 2017, and only 12 to 27% were from low-income countries. The four main non-communicable diseases, which are the main focus of the UN Sustainable Development Goals, are cardiovascular disease, cancer, chronic respiratory disease, and diabetes. COVID-19 places people with these diseases at a greater risk of being critically ill. Because of a general lack of facilities inside and outside health systems to prevent and treat those non-communicable diseases, low-income countries are the hardest hit. Many citizens may not have access to healthcare services that they need, so the achievement of the universal health coverage goal is very crucial.
Nanotechnology can be defined as the manufacture of materials and devices on a scale of molecules or small group of atoms, known as a nanoscale. Measurements in the nanoscale are made in nanometers, which is 1 times 10 to the negative 9 meters. The average size of nanotechnology devices are about 10 to 100 nanometers in width. Smart pills are nano-sized electrical devices that are shaped and designed as medical pills and are used to perform more advanced functions in the body, such as sensing, imaging, drug delivery, and vaccine delivery. Nanobots are robots, usually 50 to 100 nanometers wide, that carry out specific tasks assigned to them, such as diagnosing diseases by collecting biological samples and drug delivery. With the production of these devices, nanotechnology may have the capability of curing cancer and other non-communicable diseases.
Applications of nanotechnology in the medical field include smart pills and nanobots. Within smart pills, there are several different sub-applications. One of them is smart pills. Another one is the Vibrant capsule and the dose tracking capsule. There's also the Atmo gas capsule and the MIT's smart sensor capsule. Moving on to nanobots, there are several different surgical procedures where nanobots can be used. For example, in eye surgeries, clearing blocked arteries, collecting biopsies. They're also used as micromotors and in cancer-fighting DNA. Moving on to discussion. So, why talk about these examples? It's important for you to understand how nanotechnology is contributing to the UN Sustainable Development Goal of good health and well being, and how it's helping the global population in general. There are several advantages of nanotechnology. Nanotech is very precise because it's on a nanoscale. It can operate on a cell to cell basis. It can also help with genetic conditions and damaged genes. Also, it can help at the production level by refining the drug production process. There are several disadvantages of nanotechnology as well. For example, the field is very new, so it's expensive to implement, and there are some risks associated with hackers hacking into the devices. More research efforts need to be attributed towards nanotechnology. There are some looming questions that need to be answered first. For example, what are the long-term effects of nanotech? What are the environmental impact of its production? Is it affordable to the general public? And what are the repercussions of accumulation in living tissue?
Now we move on to our conclusion. So, in summary, the United Nations aim is to ensure good health and well being for everyone on the planet, regardless of age, and they intend to accomplish this by creating universal healthcare coverage by the year 2030. However, at the current pace of progress, this target might not be reached by 2030, owing to a shortage of healthcare staff and supplies in many countries. The COVID-19 pandemic has slowed this development even further and overwhelmed many medical facilities. Nanotechnology has shown great promise in the quest for a cure to combat non-communicable diseases such as cancer, diabetes, and respiratory infections, among others. The creation of nanobots and smart pills has shown the medical applications of technology. With cancer as the leading cause of death in most countries, nanotechnology may play a significant role in lowering mortality rates. This will help the United Nations reach their Sustainable Development Goal, which will improve the lives of all. And then here we have our references that we utilize to produce our report. Thank you all for listening to our presentation on the use of nanotechnology to ensure well-being and good health for all.